Good afternoon, everyone. I would like to welcome everyone to today's webinar presented by SymphonyCare. My name is Joseph Cochran. I'll be presenting with Brett Stanley, my partner. And today we'll be looking at 7 ways for NextGen customers to better engage patients. I ask that you please feel free to send any questions, and we'll get to as many as possible at the end of the presentation. And also, there will be a recording of this webinar available tomorrow, and we'll be providing the link at the end of this presentation. So before we get started, please allow me to briefly introduce both myself and my partner. My name is Joseph Cochran. I am the Vice President of Population Health here at SymphonyCare. Some background on me: I've spent the last 15 years in healthcare with experience in direct acute patient care and clinical education as a nurse and educator. And for the past 8 or so years, I've been in health IT, including EHR implementation, product development, and consulting, including work as a NextGen certified professional. My primary function here at SymphonyCare is working with our population health management applications, with our systems and hospitals in directing population health programs. Now I'll let Brett introduce himself.
My name is Brett Stanley. I am Vice President of Product Management for SymphonyCare, specializing in patient engagement. I've worked in IT for 20 years, the last 16 years in healthcare integration. I started as an engineer, and I worked for several health systems and health software vendors before coming to Empower in 2012. I've led the Empower Enterprise Patient Portal team for the last several years.
So why put together this presentation today? Well, the answer is simple. We wanted to share with others what we've learned in our experience related to patient engagement. Over our years of working with clients while implementing our Empower Patient Portal, we've come across numerous questions and requests related to patient engagement. Whether it be questions such as what strategies have you seen work, how were these strategies implemented or even decided upon in the first place, or what are some common successes or failures. We've also heard numerous requests for high demand items to improve patient engagement, such as a more robust mobile functionalities, possibly immediate patient access to lab and test results, or patient-driven scheduling as listed. The common theme of all is the same though. How can we better engage our patients in a meaningful way that produces better patient engagement, thus leading to better outcomes while making our healthcare system a more valuable resource? With that main question and main theme in mind, we decided that we were going to analyze our customers to determine what are the best evidence-based practices that led to their improved patient engagement via our Empower Patient Portal. For today's presentation, we focused on analyzing our NextGen clients in particular, and found that there were 7 areas that were key to improving patient engagement. These include the 7 items that are listed that we're going to take a look through today, and I'll go ahead and pass it off to Brett to start off.
For many Americans, smartphones are their only access to the internet. In fact, over 25% of adults under 50 years old do not have broadband at home and rely on their mobile device exclusively. The Pew Research Center has been tracking this trend over time, and over the last 5 years, we've seen a steady increase in the portion of our neighbors who rely on their phones. Amazon's Prime Day gives an interesting insight into how having an app on our phone changes our behavior. This year, even with some major technical glitches, foot traffic to brick-and-mortar stores fell between 5 and 15% during Prime Day compared to the average daily attendance rates for the half-month prior. Outlet malls were down 10%. Wholesale stores dropped 14%. This means that for a large number of Americans last month, people chose to use a mobile app instead of going out shopping. Our relationship with the app on our phone was stronger than our bond with a real place. The app is just easier to use. I don't have to stand in line. It's a curated experience that's just for me. I love that I can use an app on my phone to buy fun summer toys. But what I love even more is that I can easily access my health information and interact with my providers anytime, anywhere. Of course, we also shouldn't force people to install an app. That's why the best patient engagement tools are designed to work across all screen sizes. Whether you use a desktop, laptop, tablet, or phone, we expect that the best patient engagement tools will just work. Those tools will use cutting-edge technologies like Angular to create visually stunning and engaging applications that will work no matter what device a patient is using. This would allow our patients the freedom to choose the right time and place for their interactions. If I'm wanting to read the detailed information on my new medication, I may choose to browse the site from my laptop so I can easily scroll. When I just want to see when the next physical is scheduled, I can pull out my phone and quickly see the upcoming appointment. The best applications are responsibly designed to give people a consistently beautiful experience on every single device. When we pause to think about our loved ones and how they use these tools, when we think about what our own mother or brother or child would want, we keep finding ourselves returning to a focus on a clean, easy to understand interface. We use these tools to accomplish a certain task. The goal in design would be to equip people with the right tools so that they can easily get things done. In our years of operating patient portals across the country, we've had the opportunity to observe the behavior of millions of patients. For example, 72% of patients, the first thing they do after logging into a patient portal is navigate to their test result. As individuals, each of us has experienced a situation where we see our doctor, then we have our labs drawn, then we're told to wait for the results. The best patient portals give healthcare providers the ability to rapidly communicate test results to the patient to minimize the patient's time waiting. Of course, patients are happier when they get their results faster, but a Harvard University study showed us an even better reason than happiness to share results automatically and rapidly. In that study, researchers measured the cortisol concentrations of women who had had a large core breast biopsy for 5 days following the biopsy. When the concentration of the stress hormone was compared to when the patient received their test result, a pattern emerged. Women who were waiting on their test result had elevated cortisol concentrations in concentrations that were approximately the same as women who had been notified that they had malignant breast cancer. Patients want to know. Not knowing, waiting, or having to ask for test results is causing harm. One best practice we see in the best tools is to post test results and all other health information as soon as it's available to us. Our implementation best practice is to receive a real-time data feed from the EHR. When test results are available, the best tool will make them available to the patient. Making test results available is an important step, but it's even more vital that we proactively notify the patient. Again, patients want to know. We've recommended that real-time alerts to the patient's preferred communication device be sent, letting them know that new health information is available. A patient can click a link in the text message, email, or app notification and securely connect straight to the test result. We know that sharing the information with the patient is often not the full story. Patients may have questions or they may want to learn more. This is why it's important to place intuitive calls to action alongside the test result to easily couple the call to action with the information that the patient is reviewing. The best tools connect to peer-reviewed patient education systems like Adam, Crane, Stowell, UpToDate, and HealthWise, so the patient can jump directly to the information that pertains to that specific test. With a single click or tap, a patient should be able to start a secure conversation with the provider regarding the result. One of the major issues we face in the healthcare industry is just getting people to show up for an appointment. We all know that no-shows cost in many ways. When we couple the power of modern technology to the insights gained from cognitive science research, together we can address treatment non-adherence. A first step in the right direction is simply reminding the patient of their appointment. At one of our NextGen clinics, just enabling reminders prior to the appointment cut no-shows from 23% down to 15% over the course of 1 month. In fact, an entire sub-industry in healthcare technology has popped up in recent years to supplement scheduling systems by placing automated phone calls and sending email reminders. I'm personally glad to get reminders ahead of my own appointments so that I don't forget, but is that all I want? Some answers to this are easy. We've seen that nearly half of canceled appointments get rescheduled. So the best flow for the patient should not only include a reminder with an option to cancel, but we think it also should make it easy for the patient to reschedule at the same time in the same flow. An interesting take on the cancellation process emerged at another of our NextGen clients. We extended the cancellation process to give the patient an opportunity to indicate the why that they needed to cancel. We then routed the cancellation messages to different staff members based on the reason for cancellation. For patients who could not keep their appointment due to transportation issues, the staff member was able to schedule transportation for the patient using a very popular ride-sharing platform that we all know of at no cost to the patient. This led to an increase in patient satisfaction, decreased missed appointment, as well as ultimately a more efficient system. Of course, the best approach will be one that starts with the patient herself. She needs to be able to see what appointments are available for her selected provider, location, and the type of appointment. The process should be clean, clear, and easy for her. It should collect the information the office needs up front, and it should automatically book the appointment in the practice system. Finally, we believe that selecting an appointment is one of the first chances we get to engage with new patients. It's one of the best opportunities we have to set a good impression. For this reason, we believe that the best tools will offer the ability to schedule appointments to people who are not even patients yet. Open to the public, we believe that our mindset is correct in that we should give a person a great experience first, and then we'll offer them an opportunity to enroll in a portal for a more lasting engagement. A survey of 2,000 patients aged 50 to 80 years old recently revealed that only half of older patients have even signed up for a patient portal account. Now, that quote doesn't call out login pages specifically, but we can use it to contextualize the need for ease of use, which starts with adoption and overall engagement via the login page. But like all of you, I am sometimes a patient. And probably like you, when I encounter our healthcare systems from that perspective, I'm reminded of a painful reality. It's really hard to get a clear picture of everything that's going on. For example, last summer, I woke up one morning with a severe headache. After a few aspirin, it didn't go away. My wife drove me to an urgent care center where they determined I needed to be hospitalized. My wife then drove me to our hospital's emergency department where I was triaged and then subsequently admitted. I spent a week as an inpatient, then I was discharged home. I had follow-up appointments with 3 different specialists, plus a follow-up with my regular family practice physician. We accumulated a lot of information from a lot of different sources, but I was very lucky because the health system that I use has one comprehensive EHR, so it was easy for my doctors to communicate with each other, and I had a front row seat to all of the information about my care. So today I'd like to share with you who makes the comprehensive EHR tool that I used. That vendor is Walmart. Walmart sold my wife a 3-ring binder. We printed out every piece of documentation we could get online from each of the several different systems. I asked each location's medical records department for copies of my chart. Eventually, I started getting bills from all the different participants, and I used my binder for those too. Now, I covered my background at the beginning, but I've chosen healthcare interoperability as my life's work. This is my day job. I'm used to various data formats. I've worked with all the major software vendors, and I know a whole bunch of acronyms like macro, CCDA, XML, JSON, ADTs, HL7, PCR. But it's sad that when I'm the patient, what I find is a web page at my hospital that has links to a bunch of different patient portals. Buried somewhere in all of the instructions they gave me might be a way to sign into each one. And then once I'm into a patient portal, I have to spend time figuring out where this particular portal keeps different information. I finally figure out what I'm looking at. And then I go learn a new patient portal for each of the other doctors I've seen. Even assuming I can poke my way around each of these different systems, I quickly found the gap between good enough for meaningful use certification and what I as a patient really want. In my case, I could download the CCDA from my inpatient visit to my laptop, but my family practice provider's system doesn't actually allow a patient to upload anything. And I never did get electronic access to any one of my specialist systems. In the interest of time today, I'll skip the story about when my cardiologist couldn't get access to my record from his own office, and he uses the same EHR inside the same hospital, and they can't talk from the inpatient system to my cardiologist in the same building. So I think I'm a fairly smart and tech-savvy person, and I think it's indicting to us as an industry that the best system that I have for managing my own health is a 3-ring binder. So With that in mind, what chance does my mother have? How about my neighbor? There are a couple of solutions ahead of us. One solution is a perfect world where everyone related to my care all use the same system. If I worked for Epic or Cerner or another big EHR today, I'd encourage you to take this route and buy one large system. For a nominal fee, we'd replace all the separate systems you currently have with one system that's always on, tuned to your needs, and meets every specialty's needs for every level of care. The other solution is to find strategic partners for your health system that understand the complexities of modern healthcare technology. We understand that there are good reasons to keep systems in place that are already working. It's less impact to staff, it saves you money, and the ability of systems to be the best solution for a given specialty, group, or location. Rather than forcing you, our client, to fit a mold, we realize that you want a patient engagement partner that can meet you where you are. A partner that understands that when we focus on the patient's point of view, we would all design our systems much differently. We build solutions so that staff and providers can use the best system for their needs. We design the patient experience to avoid making them inherit the challenges of our current fragmented environment. The best practices for this are going to tackle the problems in a few key ways. First, we would recommend aggregating clinical and demographic data directly from your various EHRs. And that was EHRs plural. We would recommend connecting with a separate inpatient or ambulatory system, or multiple ambulatory systems, or including your specialty systems, any combination of systems that you currently have in place. The best tools would bring all the data together in one place for the patient to see and interact with. Each piece of data should say where it's from. We would recommend normalizing across all the sources, so the same allergy or medication doesn't have to show up multiple times just because it was in multiple sources. Once you see everything in one place, then you should tie calls to action to each piece of data. For example, if my mom sees a medication listed that she doesn't remember, she can click once to start a secure conversation with the provider who added it to her record. My mom shouldn't have to know that her provider uses NextGen or Allscripts or Cerner or any other vendor. She should just be able to talk to her doctor about her medication. The doctor receives the message as a new task in NextGen. It's attached to her chart. The doctor replies. His reply gets routed back to my mom, and she gets a notification. It's clean. It's simple. That's how technology is supposed to make our lives better. The best tools will thrive in best-of-breed environments. They would bring their combined decades of integration experience navigating the waters of healthcare interoperability to help solve those challenges as we see them in modern organizations. We would use technology as a tool to improve the experience for the patients and providers. Joe?
Thank you, Brad. So going forward with data, whether it's data, clinical data, discrete data, and eventually big data that go into big data reports and so forth. In health IT, we understand and hear constantly that data is important, and themes such as big data are all the buzz. But what data is important to help engage patients? Is it just a diagnosis? Is it a medication? Is it a lab result? What is it? Also, when speaking of important data, is just having a quote-unquote important data report ideal? Or is creating an actionable plan for improvements based on the data of that report the ultimate goal in patient care and engagement? In today's healthcare marketplace, we found that we have to create treatment plans on more than just a diagnosis and more than just a test result, but on all of the factors that make up a patient preferences, cultural norms, religious beliefs, education level. Those are just some of the key non-clinical data points that drive patient lifestyles and decision-making. They're also some of the key ingredients that we need to determine a better plan of care for our patients that is tailored to meet that patient's needs. We feel, and research has shown, that social determinants of health are just as important to identify and to utilize in planning a patient's treatment plan as any lab result or any test conducted. By constantly capturing and utilizing these data points, amongst others, we've been able to create focused plans of care with our patients that aim at making sure they feel that they are being listened to and treated by a coordinated care team that sees the whole person and not just the disease being treated, not just a patient on a screen, not just a point-and-click system. Again, patients want to know that they, the whole person, are being treated, and that their views, concerns, and beliefs matter, and not just their medical condition, not just their blood pressure, not just their last A1C reading. By utilizing these important pieces of data to create patient-tailored programs, it allows clinicians and staff to create higher levels of patient trust that lead to more engaged patients that lead to better outcomes. So how do we do this? We take a multi-step approach to this. Number one, collecting and expanding upon the needed data, from diagnosis and utilizations to patient preferences, cultural beliefs, and more. If it's being gathered into your system, then it's considered important, and it's an important attribute to patients and their care. Two, working with our clients to determine the best way to both group patients together and to treat said patients in an efficient and targeted manner. Look, we're a company, we're not you, so we believe that your providers know your patients best, and we configure our systems to put their expertise into the applications while also allowing them to personalize the message according to the specific patient. Third, we use our applications to create and enact the right plan of care for the right patient based upon the holistic view of the patient and your provider's plan. And finally, we evaluate outcomes and gaps to make sure that we're meeting the needs and getting the best outcomes for our patient population. So building on the ideals of data-driven platforms and focusing on patient engagement, it's not just figuring out what is best for the individual patient, but also making sure that your providers are able to get their patients materials that best fit their needs and capabilities. This includes tailoring a provider's approach to an individual, not just in what the content of our message is, but also the method in which it's delivered. Simply put, communication is key to engagement. Every day throughout the country, regulations, CMS, EHR systems, payer groups, and more, they all demand that our providers submit quote-unquote meaningful data in a specific way when documenting on their patients. This is done so that it can be utilized for things such as better healthcare collaboration, analyzing metrics, adjusting payments, creating quicker and more accurate patient treatment plans, advanced research opportunities, reporting, and an increase in better patient outcomes. And yes, all that does sound great. The issue, though, is that while our providers are concentrating on documentation and clicking on screens and looking at a computer screen while doing so, our patients are sitting by the wayside because they're lacking personalized engagement that would allow them to be treated in a way that best suits them and doesn't just quote-unquote check a box on a screen for a meaningful data point. We've all heard and prescribed to the holistic patient approach. So with that said, we want to put to use the information we receive on the whole patient to create not only the best options for a treatment plan for your providers, but also the best and most effective method for the patient to review and participate in that plan. This is less of a shotgun or a one-size-fits-all approach to engage on our patients, but more of a targeted and specific way to reach the patients that will get the best outcomes. Just to share a personal story with this, I like to think about examples I've run into in my days of direct patient care. In particular, an instance where an OBGYN was faced with two first-time expecting mothers. One, a newly married 25-year-old woman who was working on her doctorate at the time, while the other was a recently emigrated woman, 22 years old, who didn't speak English at all, and whose husband and entire support group were in another country. While the hopeful and best outcomes for each are obviously healthy pregnancies that result in no complications and the delivery of healthy newborns, the way that the provider prescribes that care and delivers the content to each of those individual women must be different, and it has to be for it to be effective and meaningful for each, for them to engage and for them to become part of their own care team. If we think about it from a medical perspective, our providers produce SOAP notes when creating their plan and to capture both subjective and objective information before creating the plan and then assess it. Our goal is to use all information gathered as well on the patient to make their experience in care and engagement more tailored to their needs. So throughout this presentation, to let you know, we've mentioned ways to improve patient engagement for NextGen clients in particular. That said, the primary tool that we've used from our company to enact these areas of improved patient engagement has been our Empower Enterprise patient portal for our NextGen clients. The Empower portal does have the capability to stand alone as a portal. However, it can be highly integrated with other systems, such as your billing, scheduling, or EMR systems, and it'll increase the power for both your patients and your staff. Going on with patient engagement as well, while focusing on improving patient engagement via our patient portal, we always continue to research and develop and improve the functionalities of our portal in various aspects. For reference, some areas that we've concentrated on include integrations with billing systems, integrations with telemedicine, and integrations with medication management systems. Basically, we looked at it like this: the holistic patient view. Wherever we've been presented with the opportunity for engagement with the patient to make their lives a little bit easier and to make it a little bit better for them, we've tried to build towards making it an area where the patient can have an easier and more efficient experience. Finally, with all this in mind, the last thing I would like to say is that on top of our Empower Enterprise Patient Portal, that again can be standalone, SymphonyCare does offer a full patient relationship management platform, aside from just the portal itself. There's, of course, our SymphonyCare Navigate Population Health Management solution that can be used by care navigators for areas such as transition of care, where you're constantly engaging with patients throughout the portal outside of the health system, as well as our Reconcile Medication Reconciliation tool and our Persist Medication Cost Management application. These are primarily used by pharmacists when engaging with patients to help manage both medication reconciliation and medication costs. Again, while patient engagement is primarily accomplished by the portal, we want to make sure that all of our applications are also valuable tools in improving patient engagement via care and medication management. So again, I would like to thank you for your time today. Brett and I will take a few moments to answer any questions that may have come through, and let's take a look and see if anything has come in.
Sure, and this is Brett. One of the questions I received, Joe, I think this would be for you. So when you integrate the Navigate tool with the Empower Patient Portal, specifically, how would you identify different population segments for driving data? And what are some of the ways you can use this information to increase patient engagement or improve outcomes? Any thoughts?
Sure. So with the Population Health Management tool, the Navigate application, along with the Empower portal, what we allow our clients to do, it's a lot during the configuration sessions and so forth, as we basically consult and work with our groups, that will actually create, we have a customized, how do I put this? A customized query builder that will allow us to look at every aspect of data that's come in, and we can actually build out customized populations of patients that our customers want. It could be something as simplistic as maybe a CCM program, where we're trying to identify every patient that is of a certain age with 2 or more chronic conditions that they're looking for that are going to be out for a year or longer. We've done transition of care programs. I mentioned that in the little demonstration just now, where we're able to actually integrate with the local ADT systems to where when we have a patient that is discharged from the hospital, again, we talked about real-time labs, we get that real-time discharge along with the list of conditions that would qualify them, ages, insurances, and utilizations. We take those and build those populations, and then we work with the providers at the system to build out tailored care plans. We talked about the targeted, the data-driven programs and the targeting. We actually can build out programs based on language, based on a condition, based on whatever you need, and actually send that to our care providers and also send that through the portal to the patient, where we can start having engagement for the patient between the patient and the care manager via both the portal and the Navigate application. So, I know that was a long answer.
Another question I received, I think I'll take this one. How do you achieve mobile and responsive design? Certainly. So the engineering teams, as we developed the latest version of Empower, now we have had Empower as a patient engagement tool. Development started in 2007. We've matured it through different technologies over the years. When we started the latest version, development started in 2013, and our first clients on it went live in 2016. Several of the new technologies that we introduced at that point on the back end was a complete refactoring of all of our services to use API-first design methodology. That allowed us to separate the user experience, the various screens that you see in the application, from the data flow. So we refactored the entire UX using Angular. So AngularJS is our front-end technology. And we built the entire site as a responsive site, so it scales to all device sizes. Then in addition, that API-first mentality from our architecture also allowed us to create native iPhone and Android applications that today are deployed and allow the same exact functionality to work from a patient who has the app installed, the SymphonyCare mobile app installed on their device, or if they were on the website viewing on any size device. Key there is API first, and then the next technology on top of that is Angular for the responsive website for people who browse the full site. And then we use a collection of mobile tools, primarily Ionic, on our mobile platform for the mobile application.
Yeah, I got one, and actually this is, can you give a specific example of how these applications were used for patient engagement at a NextGen client? And yeah, I'll go ahead and I'll take that more from the kind of nursing aspect. At one of our clients that was using NextGen, and we talk about integration and we talk about the patient portal, about Empower and Navigate. With the population builder and the query builder that I was referring to earlier, along with the integration into the NextGen system and into the ADT, a separate ADT system as well, it was at first a manual process for this hospital system that they were checking things like census reports, conditions, and so forth. Well, we were able to actually go in and implement our systems of both Empower and Navigate, and we were able to identify, and it was actually on the first day, that's why I'll never forget this. On the first day, we had several patients identified that were missed in that manual process, that we received the ADT from the NextGen system along with the conditions and so forth, and they qualified them for one of our programs. They would have been missed for this transition of care program, and one of them was a very high-risk patient at the time. What that allowed us to do was to get them enrolled into the transition program automatically through the system so that no patient fell through the cracks. And then with the care plan that was sent over to the actual care navigator or care manager, that started up the care plan, which was also sent over to Empower and started the engagement process with the patient themselves. Again, it sounds like a simple thing, except for within the first 3 hours of an implementation, they realized that they had already missed 2 patients, one of which was highly critical with a history of multiple utilization. So again, NextGen client, a lot of manual processes and so forth, we were able to tie in all the systems together to improve not only the engagement, but identification of patients and patient engagement as well. So I think that's about it for right now. Again, I would like to thank everyone again for their time. If you do have any further questions, of course, please feel free to email either myself or Brett Stanley. We'd be happy to, talk with you, personalize, or go over anything or any questions, success stories, anything that you need. We're here for you. And also, please be reminded, if you go to www.symphonycare.com/nextgen, you can watch this presentation again, and you'll be able to get the slides and any questions along with our contacts as needed. Thank you again, and I hope everyone has a great day.
All right, thank you, everyone.